Hi, I'm Dr. Nathan Leigh, one of the partners at Edina Plastic Surgery, and today I'd like to educate you a little bit about various breast implants and their benefits and downsides. I have a saline implant, I have a textured surface gel implant, and a smooth surface gel implant. All of them have different good points and bad points, and we'll start with the saline. Now, the saline implant is filled with salt and water, so it's less expensive. It can go through a smaller incision because the implant actually goes in deflated, and it can fit through, say, a 3-centimeter incision. The filling tube then lets us fill it up in place. My demonstration implant here has a 450 cc minimum fill, moderate profile. It can go up to 480 cc's, and the reason you might fill it fuller is you can see it's fairly liquidy, and that can show up actually through the skin as ripple. So let's see what happens when we add some saline. Right here I have filling port equipment, and during surgery this tube inserts right in the fill port, and through a closed system, that's how we fill the implant. On a closed system means there's no air that gets in the saline, and the risk of contamination is greatly reduced over previous techniques. And the syringe just delivers 10 cc's per time, and I'm going to fill it to its upper recommended fill range. And you can see that it's a little fuller, but still has ripple. So one of the buggers of saline, especially when you bend over, is ripple on the side of the breast. So we can also overfill saline implants, which I'm going to demonstrate here. So right now, it started at 450, now we're 480. Let's put in 100 more. So now we're at 580 over the recommended fill range, but you can see that the implant has a little less ripple, but it's also a little firmer. Let's go another 100. Now we're well over the recommended fill range at 680, but you see the implant still is somewhat soft. Now it's rounder, and it'll maintain its shape better. So people that want kind of a full upper breast all the time might select a saline implant and overfill it quite a bit. Let's move on to the textured surface implant. A few things that you should know about them. Some of them are anatomically shaped like this one, and they're all cohesive gel. So what that means is it's form stable. When you sit up, it looks like a breast, but when you lay down, it also has shape. So at the beach, you're going to be projecting. Now, an implant that's shaped also can rotate in the pocket, and if it does that, your breast will not have the best shape. So they're more expensive. It's difficult to get a perfect result, and I think they're less comfortable for the patient. So basically, we don't use those here at Edina Plastic Surgery. However, there's a rare occasion, depending on anatomy, bodybuilders, what have you, where we might have use for this implant. All right, our next and final implant is a smooth-shelled silicone gel, cohesive. So this implant, as you can see, is soft this way and soft this way, but has less ripple. So all modern silicone implants are what's called cohesive. They're thicker, there's a cut in the shell, they won't really leak out anymore. So it's a very nice quality implant. This is the one that we use most often here. So everybody's curious what's in a silicone implant. Let's find out. I actually got one from the company. They're gonna let me open it up. Now we have two halves. So a gel implant is actually semi-solid. So in order to get this through a small incision, We use this insertion funnel. As you see now, it's a small end, and it can squeeze this implant into the patient's pocket through a very small incision. Works very well. One of the questions I usually get is, how strong are these? Well, let's find out. So I have the 5th generation silicone gel implant here. Let's see how tough it is. What? You don't think that's enough? All right. Okay, now that's impressive. If you're interested in more information on breast implants or would like a consultation with our experts here at Edina Plastic Surgery, consultations are free of charge. We'd be glad to help you.